Good morning. My name is Sheila Roher, and I believe in the power of stories. Medicine comes out of particular cultures, so it's very important that we understand ours. And when it comes to the story of aging, we learn it early. How many of you were told when you were a child or a teenager, raise your hand on this, had some grown-up come to you, possibly inebriated, and look at you and say, these are the best years of your life? How many have had that? Look at this. That's a terrifying statement. Really? Like I peaked at 9, middle school is it? Well, the good news is that with the story of aging, like pretty much all the stories I was told about gender and sexual orientation, that too is wrong. The bad news is we mostly believe it. We've done something strange because in the last 150 years, we have dramatically improved health. We've extended life expectancy for decades, so people are living longer and staying functional for longer. But we've created a story about aging that's so negative that a sizable number of people say they'd rather die than get old. This is a new story. Now, no society likes decrepitude or frailty, right? Let's be real. But most societies valued and depended on the second half of life and on qualities that take time to develop and can get better with age. In the late 19th century and early 20th century, and it started here in the US, then spread to Europe, we changed our cultural values and we began to celebrate youth and stigmatize aging. Listen to the father of modern medicine here in the US, William Osler, who told an audience at Johns Hopkins Medical School in 1905 that the effective, moving, and vitalizing work is done between the ages of 25 and 40, those 15 golden years of plenty. He went on to say that if you subtract from history all the achievements of men over 40, because of course only men count, right? Right? So attract everything that men over 40 contributed to society, and it would look pretty much the same. All right, so leaving aside for the moment Gutenberg and Galileo and Newton and those guys, William Osler himself, from age 40 to 56, revolutionized medicine in the US. He's the one who introduced grand rounds and the whole system of medical residencies and internships, and insisted that students meet with real patients. Cultural stories work like spells. They can make brilliant people say stupid things. And they become even more powerful when they're backed up with science. And that's what happened. In the same period, late 19th century, early 20th century, with the rise of modern medicine, social conditions that were viewed as undesirable, or inferior, or abnormal, like homosexuality, like certain female troubles, like aging, were reclassified as diseases. Now, today, we talk about aging either as a pathological process or as a process of natural deterioration associated with diseases. None of it's good. And that's the story of aging as pathological and socially devalued, that all of a sudden can make middle school look good to people. Right? The problem with it is that it's toxic. It's a story that gets under our skin and can hurt our health. And I'll give you just one example. One study that followed hundreds of older people for more than 2 decades found that the people who had more negative attitudes towards aging were significantly more likely to suffer impairments, enter nursing homes, and they died on average about 7.5 years earlier than the people who had more age-positive attitudes. Now that's the people you'll be treating right here in the community. When it comes to medical ageism, we're at ground zero. Because the guy who coined the term ageism, Bob Butler Center on Aging right down the block at Mailman, first recognized ageism here when he was a medical student. Bob had been raised by his grandparents, and when he came here, he was really horrified at the language and the treatment and the therapeutic nihilism he saw directed towards old people. Now, he saw this clearly, but to most of us, medical ageism is invisible. So let me tell you a story, see if you can spot it. And it's a very typical story. A few years ago, a friend of mine called to say that her mother was losing her mind and they were going to have to put her into a nursing home. Margaret, at that time, was 87, living on her own, not too far from here, a real Times crossword puzzle fiend. But in the previous couple of months, she had really deteriorated, gotten confused. They were worried about her safety. It was looking bad. 5 or 6 months prior to that, her cardiologist had prescribed an ACE inhibitor to treat hypertension. And my friend called and said, is there any chance that the drug is causing the confusion? And he said, board certified, he said, it's highly unlikely. I've never seen it as a side effect. It's really not reported in the literature. And prevalence rates of dementia in your mom's age bracket are very high, 30 to 40%. But my very stubborn friend decided it was worth a shot and stopped the medication. It took about 6 or 8 weeks, but Margaret fully regained cognitive function. And she went on to continue living on her own for another 2 years until she died from a fall. So how many of you think the cardiologist might have blown it a little? Raise your hand. Let's unpack it. The drug that he prescribed, there was nothing unusual about it. It was approved on the basis of 2 clinical trials lasting 8 and 12 weeks. And the symptoms took longer than that to surface. So those trials never captured the side effect. Moreover, there were very few patients in Margaret's age bracket in those clinical trials. So we could say the lack of data was like the dog that didn't bark in the night. And maybe we could criticize the cardiologist for not hearing what wasn't there to hear. And what about the prevalence of dementia rates that made him more comfortable with the diagnosis? Well, that's problematic too, because with the rise of chronic disease, we now have millions of middle-aged and older adults, and now increasingly young adults and children, on multiple drugs for decades. I asked Dr. Butler about this. This was one of his areas of interest, and I said, how many older adults with dementia might actually be suffering from drug-related side effects? And he said, we have no idea, and we have no systems in place to try to capture it. That's how medical ageism is invisible. It's systemic. It creates the lack of data and the assumptions that make it possible for a good doctor to possibly send off a woman to lose her mind and for freedom for the rest of her life. This is a dangerous situation. Sometimes it just comes in to our assumptions and even the language we use. For example, I often hear that low blood counts are normal for aging, when in fact it can be a symptom of MDS, which tends to happen later in life. Or have you ever heard that hypertension is inevitable with aging? Anyone hear that? Yeah, that's not true. We like to say it. It's highly prevalent, right? Like 60 to 70% of older adults have hypertension. But we know from cross-cultural and experimental studies that it's caused not by decades of living, but decades of a Western lifestyle. You know, the pizza and TV catch up with us. How do you think it affects patients when they hear it's inevitable? Think it helps compliance? So, it's a hard thing to talk about, and I have to be honest and say that all through the 1980s and 90s, I was running medical conferences on chronic disease. And I was very concerned about polypharmacy in an aging population. I got that that was an issue. I completely missed the story of aging. Completely missed how our negative attitudes towards aging were informing our perspectives and shaping medical practice. But at the same time, 80s and 90s, I was also working on AIDS and HIV. And they're crystal clear about story. I was totally galvanized by how our cultural narratives around sexuality and drug addiction drove the discourse and shackled our capacity to respond effectively. I didn't get it about aging until it got personal. When I saw how my mother's age was making her invisible and affecting the quality of care she received. And I really had one of those Oprah aha moments. I thought, my gosh, this is like being gay. When the quality of care depends on whether someone sees you or a label that they fear. Which brings us back to the medical model of aging. When we talk about reverse aging or anti-aging or premature cellular aging, we are, if we're not scam artists, if we're scientists, we're trying to talk about something that's very important about cellular health, about why we thrive or decline or become dangerous. But why do we use this metaphor of aging cells? It's not about time, so where does it come from? Many decades ago, biologists working in this area decided to define as senescent or aged a cell that stops replicating. Like old people, they stop reproducing, right? That's how we got it. So I've been thinking, what if they had back then just called them gay cells, right? Those cells stop replicating. We think they've turned gay. Right? And then we would be talking about Alzheimer's and cardiovascular disease and many cancers as gay-related. And we'd be promoting diet and exercise as effective anti-gay strategies. And how would that get under our skin? And how would that affect the health of gay and lesbian people? Now, the research that's going on in cellular health is extraordinarily exciting. And even with all the crap, this is a great time to be entering medicine. But when we use language and concepts in medicine that pathologize life and people for living longer, we become dangerous. If this sounds like I'm leading up to saying to you, please don't be ageist and apply a very critical lens to anything you're taught about aging, yes, please do that. Question the data. If there are clinical trials, ask whether older adults were included. If so, which ones were not all alike. If you hear something is common or inevitable with aging, if it's not death, look under the hood. Right? But we need to do more. Many of you will live long lives. How many of you, and I need you to be honest here, how many of you feel that our society gives you a real vision of how you can live an exciting and meaningful and purposeful life well into your 70s and 80s and even 90s, because many of you will live that long? How many of you feel we give you that vision? We're going to your workshop. The one guy who raised his hand. But for most of us, it's a failed story. I created Radical Age Lab as a vehicle to help change the story, and I need your help. I'm not minimizing frailty, nor denying death, or the challenges that can come later in life. But we could do a lot better than a story about aging that actually makes people sick and holds up middle school as the apex of our lives, right? Not a high bar. The best social stories, whether they're about race or gender or age, expand our vision of what it means to be human. They support our capacity to thrive and imagine and love. We need to create a new social imagination around longevity that doesn't try to reverse aging, but befriends our future selves. We need to create a world in which you'll want to live a long life. I can tell you from my own experience and from my reading of history that changing social stories is really hard work. But I can also tell you that when I graduated college, fewer than 5% of medical students were women. 20 years later, it was close to 50% because of a change in social imagination. And in 1975, homosexuality was finally declassified as a disease. Radical change can happen when we dare to ask different questions and imagine new stories. And since none of us have decades to waste, start now. Thank you.